Now, the COVID-19 vaccination rollout and access to essential healthcare services, including the collection of chronic medication, have all been derailed by the ongoing unrest in Gauteng and in KwaZulu Natal. In the same breath, some healthcare centres have been overwhelmed by the number of trauma cases as the violence spiked in the middle of this week. Healthcare workers are unable to travel to work due to petrol shortages and the unavailability of transport. And Doctors Without Borders says a number of their supported healthcare centres have also been impacted. For more on the story now, we're joined by the MSF's Senior HR Advisor, James Kambaki. James, great to have you with us on the show, albeit to reflect on a week that's been incredibly difficult for our medical services. Tell us as a start how MSF in particular has been impacted.
We have been impacted as others. MSF is running medical operations in all the provinces that has been affected, KwaZulu Natal and Gauteng as well. We have been supporting Ministry of Health facilities with COVID intervention. And with this situation, we have also tried to support other facilities with healthcare workers to actually release a bit of pressure on their facilities. So we have been working hand in hand with the ministry, especially for the COVID vaccination, for the COVID intervention, supporting in healthcare facilities across in Ishowe. We are in Gauteng, that is Pretoria, and also Eastern Cape. So
this supporting role impacted, of course, by what we've seen unfolding in those two provinces in particular over the past week or so.
Yes, indeed, because there is a demand for healthcare workers to support in these facilities. As you know, COVID by itself was a burden, and then an influx of casualties in ER centers also increased because of riots. And that necessitated that we try to select which facilities that we could support, and we are trying to actually send a few field workers to support in those facilities.
So, James, aside from the immediate impact on that supportive role that MSF has played around the country, not only in those two provinces, what will be the long-term impacts of what we see happening this week, particularly insofar as the collection of chronic medication is concerned? That's also seen an interruption.
We do not have a clear overview of the extent of the situation at the moment. We are still assessing to find out really how the long-term impact will be. But definitely, as some of the facilities are closed and some the supply chain is broken, there will definitely be a long-term impact on supplies, and also now when these facilities are open, the overbearing now of the patients coming in to those facilities. We also possibly see that COVID will still be a major issue after the situation. So this is a long-term thing that we could possibly see coming back because this has been interrupted, and we see the situation that will possibly overwhelm. We're already at that wave, and this third wave is quite taking actually a lot of intense resources and workforce. Yeah. So this will definitely continue after.
So a number of the facilities where Doctors Without Borders operates, particularly in Gauteng, impacted by what we've seen over the past week. The Jeppe Clinic, we're told, also closed since the riots began. Is that still the case?
it was clean. It was closed. We are going to assess it today to see if it's open. Possibly it will be open. Other facilities are still running. We are going to also, we've been supporting Alexandra Clinic, and we're going to start supporting also Bulvolas Clinic and hospital, just to actually work hand in hand with the Ministry of Health to see where the gaps are and how we could actually support.
James Kambaki, we appreciate your time this morning on the AM Report. He's with Doctors Without Borders, just giving us a sense of the impact of the past week's rioting on the healthcare systems, particularly in Gauteng and in KZN as well.